This is Karen from Huntsville says, I am diagnosed with hereditary hemochromatosis and interstitial cystitis. When I went to the emergency room already in pain, they ran excruciatingly painful tests. I told them the only thing I could take for pain that didn't upset my stomach is Valium. They thought I was just seeking drugs. Why do doctors, emergency room, and regular practice think we're drug seekers when all we want is pain relief? Why do they not listen to us when we know what our bodies can tolerate?
Yeah, it's a good question. I mean, something that we see, all of us see routinely, and it really comes back to sort of two things. You look at try to put yourself in the ER's shoes, and it'll help you figure it out. Number one, unfortunately, there's really no great objective test for pain. If you're having a heart attack, there are blood markers, there are EKG, there's things that I can look at that objectively tell me not only if you're having a heart attack, but how bad the heart attack is. And obviously you can talk to the patient, you can see how they're breathing, you can see vital signs, all that stuff, right? With pain, there is no blood test that I can see how much pain you're having. The only thing that remotely comes close to looking at pain is something called a functional MRI, but that's looking at a lot of chronic changes. And those are only done really in academic centers. You can't really get it done just randomly. So it's more of an academic tool right now anyway, and it costs a lot of money. So, and that too, it's not going to tell you how much pain you're having at that second. So there's no great way. So what happens is the ER sees, for every Karen that walks in, they see 10 other pain patients that might not be legitimate. Or maybe they see 10 patients that are legitimate and one that's not. Regardless of what the ratio is, you can blame it on society. You can blame it on our neighbors or people who live down the street from us. People who unfortunately do have some type of a problem with medications and are drug seekers. And every time you see one, it jades you a little. And so the ER doesn't see one, they don't see two, they see many of them. Sometimes, depending on where you live, they can see scores of them in one shift. And so you see all that, and you simply don't know who's legitimate and who's not legitimate. I guess one way to sort of differentiate between that is if Karen had a legitimate pain specialist or a legitimate primary care physician or whoever who is well trusted in the community, who the emergency room called and said, hey, can you please give us the story on Karen? Is she legitimate? What's going on? That's one way to sort of overcome that. But if you don't have someone like that, someone with credibility to vouch for that patient, it's very hard for that third person to know if she's telling the truth or not.